Happy evening. I'm Dr. Anish Kurias from India. I'm here to introduce Ayurveda for this part of the world where my science is totally unknown. I travel such a long distance not to teach some chairs. So it's very shocking to see the chairs more than the people. But still, I'll try to explain what exactly I have to explain about this science. So I've seen so many presentations happening over here where people are coming and then presenting it with the slides. It's more better if you people can ask me questions and I can explain. As Ayurveda is the oldest medical science in the world, which is having a history of 4,000 years. And we have a department called Ayush department in India, where this particular science is taken care, and there is a ministry which is providing all kind of legal and the classical explanations and the supports from the government side. So since it's a very vast subject, it's better if you can ask me questions and then I can explain about the areas where you people are looking for some explanation. Yeah, it's a very good question. This is the first medical science which explained about branches in medical science. We have Ashtanga Ayurveda, which is 8 branches. But this is mainly dividing the subject into toxicology or the general medicine, sometimes the pediatric, like that. But mainly, Ayurveda is not focusing on treating the disease. So we normally divide Ayurveda into 2 portions. One is the treatment for the mind. The second is treatment for the body. So always the mind is taken care in Ayurveda, same with the body. I've seen here so many presentations where the people are more concentrating on the biochemistry changes or the lab reports. And correction of the lab report is understood as treatment. Whereas in Ayurveda, we don't look into such things. We try to understand exactly what is happened with the patient to go for that particular onset of the disease. And we find the root cause and try to read the root cause. The root cause may be sometimes the mental side, sometimes the physical side. So this is the broad division of Ayurveda, the mental disorders and the physical disorders. The best part is in the mental disorders, when we are treating a patient, we take care of their physical things. And the physical disorders, when we are treating a patient, we take care of their mental disorders. For example, a case of psoriasis, if it comes to us, instead of just treating the psoriasis, we treat their mind first and give them understanding that this is a manageable disease, is a curable disease, if they cooperate with us. And treating the mind first and making the mind calm, after that we take care of the body. A patient of schizophrenia comes to us, we don't treat the mind first, we treat the body. The problem may be because of the digestive system or some other problems. So identifying that and treating that and correcting that, and then we will set the mind. So the cure is possible in most of the conditions than just management of the disease. Thanks for your question. Origin of Ayurveda. Yeah, as I explained, 4,000 years back, this science is written. That particular time, nobody was looking for any Nobel Prize or, like any acceptance or, like monetary benefits, nothing. So first, Ayurveda explained about when to wake up, when to sleep, and what to do in between. We call it as Dinacharya. It's like the daily regimens. After that, they explained about the seasonal regimens, how we have to accept and change the season, or how we have to take care of the seasonal changes. After that, I explained about how to cook food, when to eat, how to eat, what kind of food, in which season we have to do. Then they explained about the exercise part. Then they explained about the mental health, how to maintain the mental health. And then they said, if you are not able to do any of these things, then there is a possibility you get these kind of diseases. Then they explained about the diseases and the disorders. And after that, they explained about the treatment part. So the most important part of Ayurveda is more than treating a patient, it's like a life science. So if you follow the rules and regulations of Ayurveda, it is very easy to prevent getting diseases and disorders.
Then there is a difference between wellness and illness, right?
Correct. Correct.
Sometimes we confuse wellness of Ayurveda like spas we see around. So, and Ayurvedic spas are there. There are wellness spas. What's the major difference between illness Ayurveda and wellness Ayurveda?
Yeah, very good question. Thank you. See, actually, I was shocked to see an Ayurvedic coffee in the back door. So, I was just asking, I was shocked because of two reasons. One is the people over here knows the name Ayurveda. The negative shock was they would have made allopathic coffee. After that, they would have made Ayurvedic coffee because allopathic coffee would have been more popular over here because the word allopathy is more popular here. But why they made Ayurvedic coffee over here? Because unfortunately, this part of the world understand Ayurveda as just massage or only wellness. You got the point? So it is much more than that. The wellness part of Ayurveda is just covering 1% of the total Ayurveda. When we can cure and manage such deadly disorders and diseases where there is no cure in most other medical science or conventional medical science, this particular science should be known over here as illness Ayurveda than the wellness Ayurveda. Now, the importance of wellness Ayurveda can be broadly divided into two. One is the wellness treatments for the body and the wellness treatment for the mind. So wellness treatment for the body is mainly with relaxation massages, circulation improving massages, and like kiri procedures, like they make a cloth bag of medicine and they do massage. They do massage with the rice, they do massage with the lemon. So according to the situation of the patient, they decide this particular treatment, which is wellness for the body. And illness Ayurveda is mainly on Shirodhara, where the treatment will be focused on the head, where they feel relaxed after the treatment, the sleep will be getting better, the anxiety disorders will be taken care, the fear will be taken care, and mainly focusing on the mind side. This is the wellness part of Ayurveda. In illness part of Ayurveda, as I explained, there is proper treatment for all kind of diseases and disorders comes for the mind, and all kind of disease and disorder comes for the body. Yeah, see, actually, before answering this thing, I should explain about how Ayurveda look at a human body. An allopathic doctor look at human body, he'll be seeing 11 systems, like cardiovascular system, digestive system, musculoskeletal system, like that 11 systems are there. But when an Ayurveda doctor look at a human body, what we see is a group of 35 trillion cells. So if I ask you, who are you? You are just a group of 35 trillion cells. And every cell, when I look, I am seeing 100 trillion atoms. And every atom, when I look, I am seeing subatoms and 98% space. So our diagnosis is entirely different from the allopathic way of diagnosis. So instead of diagnosing the disease, we diagnose the patient. For example, just now somebody was asking me about, do you have treatment for menstrual disorders? So the answer is like, a person come with menstrual disorder will be having headache. And the same person will be having some skin disease. And the same person will be having some other disorder. So for which disease I will go for diagnosis and which disease I will go for treating. So here, the Ayurveda is so different from the other medical science, mainly on diagnosing the patient. So we interact with the patient and we have our own techniques of diagnosis to understand what is the reason behind these symptoms. And once you point the particular reason, we will educate the patient to stop doing the reasons. So sometimes the patient will be sleeping in the daytime or eating the food very late in the night, not doing exercise, not being happy. So going to that particular point and correcting them is considered as half treatment. So any of the diseases we can treat in Ayurveda, but it is completely depend upon the patient. If the patient is not following the rules and regulation, then it is very tough in Ayurveda to treat. But if the patient is cooperative, if the patient is having common sense, then it's very easy to treat any kind of the disease and disorder. We have patients from almost all European countries. Last week I was having 2 patients from Slovakia, and even I have a video which is made in the local language where she explains about her experiences in our hospital. So mostly the patients are coming with the psychological disorders, and 50% of the patients are coming with the respiratory disorders and cancer, and then skin disorders and sleeplessness. It's a very main problem over here. These are the main conditions we get. But again, if the patient is following the rules and regulation, till the time they are admitted with our hospital, we will make sure that they are waking up at 5, sleeping at 10, and doing all the rules and regulations properly. Thank you. not only the cancer, if the patient is diagnosed with any of the disease and come to me, I don't treat for that particular diagnosis. We don't take the diagnosis of other doctor and do the treatment in our science. We have our own diagnosis. And in that diagnosis, if the patient is coming in the bracket of cancer, then again we will analyze why it is so. What made him to get the cancer condition? And we treat for that particular situation and then correct the patient in the mental side and the physical side. It's not about the cancer, it's about what is the condition of the patient when he come to us as per our science. As per our science, if it is treatable, it's very easy to treat. Hey, it's a very good question. See, every time this is a kind of question we get, but in Ayurveda, again, I said the treatment is highly personalized. So I cannot say in cancer what is our percentage of success, because sometimes the patient comes with the cancer and it is not cancer as per our science. Recently, I got a patient from Germany and the diagnosis was multiple sclerosis. After 21 days of treatment, the patient was able to run instead of walking. And she started saying in Germany that I'm very good in treating multiple sclerosis. But actual fact was, in my understanding, she was not having MS. So, the treatment for the patient is entirely different from treatment for the disease. I always keep asking this question to myself and to other doctors who come across me, that my fingerprint is so unique. No one in this room or no one in this world is having the same fingerprint. My DNA pattern is so unique. So how can I get the same medicine for fever and the same medicine for other gentlemen? Everyone is so unique. So industrialization of the medicine is the reason behind same medicine for same disease. So when you treat a disease, you can talk about success percentage. But when you treat the patient, talking about success percentage is a bit difficult. When the patients are recommended by other patients who experienced, their understandings are very proper. They understand that this is not just a medical science, it's a holistic science where they have to follow the rules and regulations. Like, our all patients have to drink 50 ml of water every 15 minutes. And no questions asked, they have to do this. So the patients who are coming from this part of the world are with high understanding they are coming, because they do a lot of research, they understand what is this science, they understand about our line of treatment, about me, about our hospital, of the facilities, everything. So they take decision, only 50% of the patient take decision to come to us, but somebody who is coming with all informations.
What are the biggest misconceptions about Ayurveda you think exist not only here, but in general everywhere? Like somebody says, if you do this, then you'll be fine. If you do that, you'll be better. Some people believe in allopathy, some people believe in Ayurveda, some in homeopathy. It's a personal belief. We cannot say that what is better, what is not better. It's end of the day what I feel comfortable with. But when we talk about Ayurveda, we talk about kurkuma or other ashwagandha or something like that. What are the biggest misconceptions which people should not have, which are there about Ayurveda?
Ayurveda is a science where the treatment with medicine and other, like treatment procedure is covering only 33% of the treatment. 66% of the treatment is not having any medicine or the treatment. This is the most important thing people have to understand, which is not understood till now about Ayurveda. See, many of the disorders we can cure just by making them to walk barefoot morning and evening. Many disorders we can cure by making them to stop eating few things. Like somebody was talking to me about psoriasis, and I said, just stop eating badam, pista, cashew, and groundnut. And you can see that the patches disappears. And they have to do 50 ml of water every 15 minutes. And the men's status is very important. See, somebody who is not having proper sleep, a very simple treatment I will teach you. Every patient is getting result in this particular thing. We ask them to do something which is totally boring for them for 10 minutes to 15 minutes or 1 hour before they go to sleep. So you take an old newspaper, read the same newspaper every day for 1 hour before you go to sleep. And you can see the quality of the sleep improves. It's a very simple solution. So no one can stop practicing Ayurveda in any part of the world. There is no legal resistance for the 66% of Ayurveda. Legal resistance is only for the remaining 33%. I love this music. This is to stop, right? Thank you.